Hello everyone, my name is Rebecca. This is going to be a little snippet about acute asthma exacerbation and two different drugs that are used to treat it. The normal pathophysiology of our airways is that they consist of smooth muscle that are controlled by vagal activity. So when the vagal nerves are stimulated, bronchoconstriction occurs. The airway also has smooth muscle that contains beta 2 adrenergic receptors, and these receptors actually cause bronchodilation. Asthma is a chronic inflammatory disease of the airways. It consists of episodes of acute bronchoconstriction leading to airway obstruction. This bronchoconstriction is resulted from the contraction of bronchial smooth muscle, inflammation of the bronchial wall, and increased secretion of mucus. Signs and symptoms of asthma can include shortness of breath, cough, chest tightness or burning, tachypnea, and wheezing. Asthma can also be triggered by any exposure to allergens, exercise, stress, and respiratory infections. There are multiple drug and drug classes that can be used to treat asthma. Two examples of these are albuterol and ipratropium. Albuterol is a short-acting beta 2 adrenergic agonist, and ipratropium is a short-acting anticholinergic. The mode of action of both of these drugs is bronchodilation. Albuterol does this by directly relaxing the smooth muscle of the airway, and ipratropium blocks vagally mediated contraction of the airway smooth muscle and mucus secretion by antagonizing the action of acetylcholine. And acetylcholine is a transmitter that is released from the vagus nerve. Albuterol is a sympathomimetic, and it has multiple drug interactions. With epinephrine, these two should not be used at the same time because that can be too much activity for the heart. Monoamine oxidase inhibitors or tricyclic antidepressants, their actions may be potentiated by albuterol. Beta receptor blocking agents and albuterol inhibit the effect of each other. Ipratropium is a parasympatholytic. Its use with other anticholinergics can potentiate their effect also. In controlled clinical trials, albuterol showed pulmonary function improvement within 5 minutes, while it took ipratropium 15 to 30 minutes. Ipratropium takes longer than albuterol to take effect, however, it may be more useful in patients who have asthma-COPD overlap. Both albuterol and ipratropium should not be used in those who have hypersensitivity to its components. Albuterol can be used in those age 2 and older, ipratropium age 12 and older. Albuterol is a pregnancy category C, and ipratropium is a pregnancy category B. Both albuterol and ipratropium cost about the same, usually around $15 for a pack of either 25 or 30. Albuterol should be used for quick relief of acute asthma exacerbation. However, if the patient is unresponsive to beta 2 agonist or they also have COPD, ipratropium may be the drug of choice.